Welcome to the PPAM Aid fitting tutorial. We're going to start with the application of a below-knee patient. Before you fit the PPAM Aid to the patient, you'll need to ensure that the stump wound's been assessed and a suitable cover applied, such as a soft dressing, clothing with soft seams, or a stump sock. You'll need to start by selecting the cushion bag and pumping in a little bit of air before folding the rounded end in on itself to form a small cup. This is then placed over the end of the stump so as not to cover more than the distal 5 centimetres. Do not attempt to insert the whole of the stump into the cushion bag. Holding the cushion bag in place, the outer bag's then pulled up to the patient's groin area. The correct length of frame is then selected by measuring against the remaining leg and slid up over the outer bag until the sole of the rocker foot's in the correct position. The ring at the upper of the frame should lie at least 8 centimetres below the top of the stump bag. The lengths are then checked by the physiotherapist. A foot pump is then attached to the PPAM Aid. A pump with an accurate pressure gauge must be used. The PPAM Aid must be inflated to 40 mm mercury before standing on it. It can be used to get the patient used to the pressure in the early stages by gradually increasing the pressure in a non-weight-bearing position. The patient should be asked to stand up by pushing up from the arms of the wheelchair. The physiotherapist may need to support the PPAM Aid and help position it correctly for standing. Leg length should be checked by the physio's hands, checking the length at the ASIS. If needed, you can adjust the length by deflating the main bag a sufficient amount and then re-inflate whilst the patient's standing. The sling support can now be adjusted so it gives support to the distal end of the bag. There will be some shortening with weight bearing, but this should not be more than 2 to 3 centimetres. The patient can now start to bear weight on their stump and walk with the support of the parallel bars. For an above-knee fitting, you'll need to follow a similar procedure to the fitting of a below-knee patient. It's advisable for the patient to stand during the fitting process. The patient should be asked to stand at the end of the parallel bars. You'll then need to select the above-knee bag and ensure it's fitted with the higher side to the lateral side of the stump. Please check that all loose clothing is folded carefully into the cushion bag to avoid discomfort. Thicker material such as denim works better to tuck into the back of the small cushion. This eliminates pressure and helps keep the bag in place. As before, a little air is pumped into the cushion bag. This time the cushion bag is folded in half and inserted into the outer bag. The correct frame is then selected and applied over the cushion bag. It's recommended that for above-knee patients, the crossbody shoulder strap is used for added security. The bag's then inflated to a maximum of 40 mm mercury. You must ensure at this stage that the patient is not weight-bearing. If needed, you can adjust the length by deflating the main bag a sufficient amount and then re-inflate whilst the patient's standing. Once the bag has been inflated and the length is correct, you can now adjust the distal straps. The patient can now bear weight and walk across the parallel bars. For For further information, please visit www.ortho-europe.com or email us at info@ortho-europe.com.